The New York Times lists Crawford and Cherokee counties in Kansas as two of the most dangerous places to be in the state if you're unvaccinated. KOAM's Zach Dodd spoke with officials in both counties and has what they're doing to combat a spike in cases.
Nurses at Ascension Via Christi are back caring for patients in the COVID ICU. A familiar scene they didn't want to see again.
We've seen a surge as far as up to 11 patients in the hospital with COVID. Right now we currently have 8.
They saw as many as 25 patients during the fall and winter. The current number isn't that high, but the hospital is gearing up for the worst.
Making sure we have all the PPE that we need, all the ventilators that we need, and everything in place.
According to Crawford County Health Department Director Teddy Van Cam, the county has seen 61 new cases so far this week and 5 deaths in the last 10 days.
This Delta variant, although it is not more virulent, it is much more transmissible, much easier to spread and to catch. And so that's what we're seeing.
She says over the last 2 weeks, testing has gone up and contact tracing has been ongoing as they combat the Delta variant. According to KDHE, 368 per 1,000 people have been vaccinated with at least one dose in Crawford County.
We want to get it higher. We need more protection.
Cherokee County is in a similar situation, seeing a 74% increase in cases in the last 14 days compared to the 2 weeks prior. That's 92 new cases since the end of June, and vaccinations are at 264 per 1,000 people.
We're seeing an average age of those who are vaccinated at 65 years old, whereas the average age of those contracting COVID is 41 years old. We need, that younger demographic to be willing to get the vaccine or take the precautions serious enough to help mitigate the spread.
We need to get people vaccinated in order to prevent another surge. We don't want to go through that again, and with the vaccination rates being as low as they are, we could possibly see that surge again.
In Crawford County, Zach Dodge, KUAM News.
Cravens tells us when they transfer COVID patients, they have to divert to hospitals farther away since Joplin and Springfield hospitals are dealing with their own surges.